I think oftentimes we read a chart and we already have a picture in our mind of who we're going to go see and what the patient's going to look like. And when you walk in, it might be a totally different story. But if you kind of go in closed-minded or focus on one lab value, you can miss all of who your patient is. Unfortunately, Madison was admitted to ECU Health, or the Maynard Children's Hospital, for treatment of leukemia in my third week of my first rotation, which was pediatrics. And I walk into this room while on pediatrics, hematology oncology, and I get called a blueberry. While I'm wearing my nice figs, my beautiful kind of blueberry colored blue figs. And Madison's mother, who at the time I didn't know, literally says he looks like a blueberry. And ever since then, kind of our relationship has just blossomed. Whether it was at the end of the day going and hanging out and she was teaching me sign language, which I barely know English that well.
It was just something that I could take time when I was in the hospital. So I just kept practicing it. And then I think one day you just asked me, like, what was I doing? And I told him, and I just tried to teach him the basics.
Or I was teaching her like physiology and pathology. It was that and like painting. Yeah. Because I also know nothing about art whatsoever. But Madison is literally one of the best artists that I've ever seen, especially for her age. And she was trying to teach me all about different paint styles and canvases and all those things. And I'm like, okay, but this is a colon. So let's talk about this blood count. But I think it was just a different, type of relationship and a different type of mindset that I'm not used to, especially being in medical school. But she opened my eyes to it.
I feel like we both learn things from each other. Like, it's so many things that I gain a better understanding from when, like, about myself, like things going on with me medically. I'm just like, why do I feel this way? I have these symptoms, Michael, help me. And then, like he said, I would talk to him about like different art materials, stuff like that. So it's just like a mutual, like, beneficial relationship, I guess.
Unfortunately, my mother succumbed to stage 4 breast cancer at the beginning of my third year, or kind of like towards the end of second year. Being in a healthcare space after you've kind of lost somebody so important to you, especially after you kind of seen them struggle, to then enter into a space where you're with somebody who has a similar disease, different, but a similar disease, it's heart-wrenching at times, right? But I think the good thing is, one thing my mom always taught me is that, happiness is about what happens to you, but joy is something that comes from the inside. And I feel like that's something that Madison not only exudes, but she also tries to teach or present to other people, whether she knows it or not.
I was like, I want to do something for Michael. So I drew him this picture. He told me that he likes to eat and stuff like that.
Clearly.
Yeah. And I ended up drawing a kitchen with a woman cooking, and there was a little baby on the ground. Like, no reason, but that's what I just started drawing. And when I gave it to him, that's when he told me about his mom. It was just like, what a coincidence, Here, I could sit here and pout all day about me having cancer. It's not going to change the fact that I have it. But I could, next time my nurse comes in, I can tell him a joke or something. Like, you have choices to make. So it's just like, are you going to sit in bed all day and be sad? Or are you going to do the breathing exercises your doctor told you to do? It's just, you have choices. And I feel like the ones you make have a big impact on how you feel.
I think our relationship has kind of continued to grow.
Our relationship is one I've valued greatly during my stay.
I hope they got it on camera.
Oh.